HESI Exit Medical Surgical Nursing, Mastering the Neurological System. Introduction. Welcome to our comprehensive review of the neurological system for the HESI Exit exam. In this video, we'll explore understanding neurological anatomy and function, recognizing common neurological disorders and interventions, applying critical thinking in neurological emergencies. This system is crucial because the nervous system controls body functions, cognition, and movement. Nurses must assess neurological status and recognize signs of deterioration. Nervous system anatomy and function. Let's examine the nervous system structure. Central nervous system, brain and spinal cord. Peripheral nervous system, cranial nerves, spinal nerves, and autonomic nervous system. Essential functions: sensory input processing, motor control coordination, cognitive processing, autonomic regulation of vital functions. Neurological assessment components. Comprehensive neurological assessment includes level of consciousness, Glasgow Coma Scale for standardized assessment, pupillary response, Perlook pupils equal, round, reactive to light and accommodation. Motor function, muscle strength, coordination, and balance testing. Sensory function, pain, touch, and vibration sensation. Reflex testing, deep tendon reflexes and Babinski reflex. Neurological diagnostic tests. Important tests for neurological evaluation. Laboratory tests. Complete blood count, electrolytes, glucose levels, and toxicology screening. Imaging studies. CT scan and MRI detect strokes, tumors, and brain hemorrhages. Electroencephalogram measures seizure activity. Lumbar puncture diagnoses meningitis and measures intracranial pressure. Stroke brain attack. Stroke has two main types with different causes and treatments. Ischemic stroke, caused by blood clot blockage leading to brain tissue damage. Hemorrhagic stroke, brain bleeding from aneurysm rupture or trauma. Stroke recognition, remember fast. Facial droop, arm weakness. Speech difficulty, time to call 911 immediately. Treatment differs by type. Ischemic, TPA clot buster within 3 to 4.5 hours, aspirin therapy. Hemorrhagic, blood pressure control, possible surgery. Transient ischemic attack. TIA is often called a mini-stroke but serves as an important warning. Key characteristics: temporary blockage with stroke-like symptoms. Symptoms resolve within 24 hours. Critical point: this is a warning sign for future stroke. Management focuses on antiplatelet therapy for prevention, lifestyle modifications, carotid endarterectomy for severe blockages, increased intracranial pressure emergency. ICP is a life-threatening neurological emergency. Common causes: traumatic brain injury, stroke, tumors, and meningitis. Early warning signs: severe headache, vomiting, and altered level of consciousness. Late signs: Cushing's triad. Increased blood pressure, decreased heart rate, and irregular breathing patterns. Fixed and dilated pupils. Critical nursing interventions: elevate head of bed to 30 degrees. Avoid activities that increase pressure like straining. Maintain airway and adequate oxygenation. Seizure disorders and management. Understanding seizure types and proper response is essential. Types of seizures. Generalized seizures, tonic-clonic and absent seizures affect the whole brain. Focal seizures, partial seizures affect specific brain areas. During a seizure, critical actions. Protect the airway and turn patient on side. Never restrain the patient or put anything in their mouth. Document onset time, duration, and specific symptoms. Long-term management. Anti-epileptic medications like phenytoin and valproate. Status epilepticus medical emergency. This represents the most serious seizure emergency. Definition: seizure lasting more than 5 minutes or repeated seizures without recovery. Emergency management. For benzodiazepines like lorazepam or diazepam. Maintain airway and provide oxygen support. Monitor closely for low oxygen levels and heart rhythm problems. Meningitis, brain infection. Meningitis involves inflammation of the protective brain coverings. Causes: bacterial infections are more severe than viral infections. Classic symptoms: fever, severe headache, and stiff neck. Positive Brzezinski's and Kernig's signs. Light sensitivity and altered mental status. Nursing management. Droplet precautions for bacterial meningitis. For antibiotics for bacterial type, supportive care for viral type. Parkinson's disease. Parkinson's is a progressive movement disorder. Disease process. Dopamine deficiency in the brain's movement control center. Remember trap for symptoms. Tremor at rest. Rigidity of muscles. Akinesia of slow movements. Postural instability. Management includes medications, levodopa-carbidopa and dopamine agonists. Safety measures, fall prevention strategies and assistive devices. Multiple sclerosis. MS is an autoimmune disease affecting the nervous system. Disease process. Immune system attacks the protective myelin sheath in the central nervous system. Common symptoms: fatigue, muscle weakness, vision changes, and cognitive impairment. Management strategies. Medications, immunomodulators like interferon and corticosteroids for flare-ups. Lifestyle management, avoid known triggers and engage in physical therapy. Neuromuscular disorders. Myasthenia gravis. Autoimmune destruction of nerve-muscle communication receptors. Symptoms include drooping eyelids and weakness that worsens with activity. Treatment uses anticholinesterase medications and corticosteroids. Emergency concern: myasthenic crisis can cause respiratory failure. Guillain-Barré syndrome. Post-viral autoimmune reaction causing rapid paralysis. Symptoms show ascending muscle weakness with respiratory involvement. Treatment includes plasmapheresis or 4-immunoglobulin. Critical monitoring: respiratory function may require ventilator support. Spinal cord injury. Spinal cord injuries require immediate and ongoing care. Types of injury: complete injury, total loss of function below the injury site. Incomplete injury, some function remains below the injury. Emergency care priorities: immobilize the spine with cervical collar and backboard. Monitor respiratory function, especially with high cervical injuries. Prevent serious complications like blood clots and pressure ulcers. You've now mastered the essential neurological system concepts for the HESI Exit exam. Remember that early recognition of neurological symptoms is crucial for preventing permanent damage. Stroke, increased intracranial pressure, and seizures require rapid nursing intervention for optimal outcomes. As nurses, we play vital roles in neurological assessment, patient safety, and family education. Keep practicing these critical concepts, and you'll be well prepared for success on your HESI Exit exam. Outstanding work on your nursing studies.